Boodleman. I am the Vice President, Chief Development Officer of the St. Joseph's Health Foundation, and the foundation puts on these spotlight talks. There are series, our yearly series, and we do them quarterly. And, this tonight, as I mentioned, is a little bit different. We have a friend of St. Joseph's in Roman Oben joining us tonight. And Roman has been, is gracious enough to join us, give us of his time, and, share with us a little bit of his personal experiences, the football world, and even a little bit beyond that. So we're very excited to have him here with us tonight. And I also, before we begin, I also want to take this opportunity to thank Charles and Marie Bruce, the Bruces, who are hopefully listening in tonight from the comfort of their home as well. The Bruces have been supporters of St. Joseph's for over 40 years. Marie is on our foundation board, and they are the sponsors of tonight's virtual spotlight on St. Joseph's. So thank you, Marie and Chuck, as always, for your amazing generosity. It is now my pleasure to introduce, actually one other little bit of housekeeping before we get into the talks. Please, everybody, please mute yourself. If there comes a moment when you're not on mute for some reason, please make sure that you are on mute so that we don't get any background noise for our speakers. And I also, very importantly, want to mention that please no screenshots of tonight's PowerPoint presentation. They are the proprietary information and property of, respectively, of St. Joseph's and the National Football League. So please, I ask everybody's cooperation with that. So now we'll begin. It's my pleasure to introduce Kevin Slavin. Kevin will make some opening remarks, update us very briefly on COVID and what's happening today with that. Kevin is our president and CEO of St. Joseph's Health. He's responsible for the overall strategic, clinical, academic, and operational functions of St. Joseph's Health, which encompasses St. Joseph's University Medical Center, St. Joseph's Children's Hospital, St. Joseph's Wayne Medical Center, and St. Joseph's Healthcare and Rehabilitation Center, Visiting Health Services of New Jersey, and many other ambulatory and physician sites throughout northern New Jersey. He is a results-oriented executive with 3 decades of health industry leadership experience and expertise. He is also the chair of the board of the New Jersey Hospital Association and has been a key member or key advisor to Governor Murphy during this pandemic. Kevin received his master's degree in health administration at the University of Chicago's Graduate School of Business. He has emphasis in financial management. He also holds a bachelor's degree in industrial engineering from Rutgers University. Kevin is a member of the American College of Healthcare Executives, a trustee and past chair of the Hospital Alliance of New Jersey, the inaugural chair of the Healthcare Coalition of Passaic County, and has had a variety of legislative appointments to healthcare boards, commissions, and task forces. And I'm very proud to share with all of you tonight that Kevin recently was awarded the Distinguished Service Award from the American College of Healthcare Executives of New Jersey for his outstanding leadership and significant contributions to healthcare within the state of New Jersey throughout this year, 2020, of the pandemic. Let us now welcome Kevin Slavin.
Thanks, Rob. Good evening, everybody. I want to thank you for joining us tonight for this really special virtual spotlight on St. Joseph's presentation. I know you're as excited as I am to hear from former NFL star and now NFL executive Roman Oben. Before we do that, I just want to do 2 things. I want to give my personal thank you to Chuck and Marie Bruce for your generous sponsorship tonight. Chuck and Marie, it's great to see your picture there before, but Wendy and I hope to see you soon. It's been too long. Also wanted to give a brief update for everybody on where we are in New Jersey, as well as at St. Joseph's in this COVID-19 pandemic and this second surge that we're fully in. You could advance the slide, please. We continue to see about 4,000 new cases daily in New Jersey. Several weeks ago, the Commissioner of Health on one of our calls said, let's stop dancing around calling this a wave. This is fully a second surge, and it is. The positivity rate of those being tested in the state is now close to 11%. That went down to 3% in September. And what's called the transmission rate, the rate that the disease transmits itself throughout the community, needs to be under 1 to diminish the disease, continues to be over 1 and problematic in terms of the spread. It's always pointed out that those elderly in the population are the highest percentage of deaths, but most recently the contact tracing information of those that have tested positive show that the highest positivity rate are among individuals in the state aged 19 to 49. So the epidemiologists in the state are drawing a direct line between younger people infecting older people who unfortunately succumb to the disease. Long-term care facilities were in crisis in the first surge, a little bit better off, but we still have 300 outbreaks across the state throughout this. The good news is although there are 3,000 people in hospitals in the state today, that compares to 8,000 at the first surge, so it's less. And far fewer percentages are in intensive care and far fewer on ventilators, 30% in intensive care and 12 to 15% on ventilators throughout the state. Those numbers were about 70 or 80% during the first surge. So our clinicians, our physicians, nurses, respiratory experts have found new and different ways to treat this disease, and more people are leaving the hospital and some discharged directly to home. If you could move to the next slide. To just give you some perspective here at St. Joseph's, at the height of our first surge, we had 456 hospitalized COVID inpatients in our 2 facilities. Most of those 2 facilities, 90% were COVID patients. September 30th, 13th, we saw a low go down to 30. We hoped that would go to 0. Unfortunately, it's continued to climb, and we're now approaching 200 hospitalized patients again at St. Joseph's. The difference in this second surge is that it's come at a different pace. First surge came in like a ski slope, very rapid increase in cases over several weeks. This has been what the experts call a staircase progression, just progressively increasing since the middle of September. There is some good news, though. We're much better prepared. If you move to the next slide. We are much better prepared than we were for the first time around in terms of additional protective equipment. Our capacity is greater. We've innovated. We have the resources. We know how to treat the disease. However, there's 2 aspects that are putting stress on our staff. One is having gone through this the first time. That's additional stress and anxiety on our frontline caregivers. We're trying to do our best to support them in that regard. And we do worry about where this peaks, because at the peak in April, we were helped by many nurses that came from around the country to New Jersey and St. Joseph's and supplemented our staff so they could get downtime and time off. We're not going to be afforded that opportunity because other states are in much worse shape than New Jersey. So one area we're worried about is staffing, but so far we're fighting our way through this. I want to turn to vaccines very quickly. There's very good news on the horizon with vaccines. As you may have heard, Pfizer and Moderna are expected to have their emergency use authorizations acted upon by the FDA. Pfizer on December 10th, followed by Moderna on December 17th. Secretary Azar today, I believe, said that 20 million doses will be pushed out across the country in December. We expect, if these approvals are granted by the FDA on the 10th and the 17th, that St. Joseph's will have the Pfizer vaccine and will be expected to and will be ready to administer that to our frontline employees a week from tomorrow. That's the mandate from the Commissioner of Health. As soon as you get the vaccine, you need to be administering it within 24 hours. So the first phase of vaccine dissemination will go to the first frontline workers in healthcare, the 1A group, followed by essential non-healthcare workers in the community, and then those with chronic conditions and over 65. We do want to carry one message to you and ask you to bring it to the community that vaccines don't save lives, vaccinations do. Unfortunately, because of the way this has been politicized, called Operation Warp Speed, which probably couldn't be a worse term for it, it led people to believe that the development and the science behind it was rushed unnecessarily. The science behind it is sound. There are independent bodies at the national level, the state level, and at each hospital that are reviewing all these clinical trials, all the data, and they will make their decision shortly based upon that, not on any political pressure. But we need to have still confidence in the community that once those determinations are made, this is a safe vaccine, and this is one of the main ways that we can defeat this disease. But in the meantime, if you move to the next slide, finally, we all just need to continue, can move ahead. We all need to continue to do what Dr. Fauci has practiced, social distancing, wearing our masks, washing our hands, and continuing to do that. And we'll continue to fight this disease and we'll break its back. So you can move on to the next slide. That's Dr. Fauci's 5 key steps to fight COVID-19 that we leave you with. So I'm very pleased today, right now, to introduce our guest speaker, Vice President of Football Operations and former NFL star Roman Oben. As a football fan myself, I really look forward to this presentation. I had a chance to chat with Roman earlier today, and I know he's excited to share some things with you. A little background on Roman. He was born in Cameroon, West Africa, moved to the United States as a child and grew up in Washington, D.C. He played his college football at the University of Louisville. Roman, Louisville just beat Seton Hall, and you have a lot of Seton Hall fans participating tonight, so don't rub it in too much. He was inducted into the Louisville Athletic Hall of Fame in 2009. He had a distinguished professional football career, which began in 1996 when he was signed by the Giants. To show you what a small world it is, he played several years with the Giants with another offensive tackle on the right side, Scott Gregg, who I met through a dear friend of mine, Julia Sanders, who's participating tonight. And I know he has a funny story or two about Scott, but Scott and his wife, Tony, are great people, and Roman can share that with you. In 2002, he helped the Bucs capture their first Super Bowl championship. And then he went on to earning his master's degree in public administration in 2000, held a number of business development roles, and retired from the NFL. He's also had an extensive media career covering the Giants on MSG, My9, and NBC. Roman has been a leader and an advocate for sports enrichment, receiving countless awards for community service, both as an NFL player on and off the field. So I'm delighted and pleased to introduce and thank Roman Oben for participating in tonight's spotlight. Roman, it's all yours.
Perfect. Thank you. Thank you so much for that wonderful introduction and bio. And I'm really appreciative to be a part of this event. I'm actually going, so as you mentioned, as Kevin mentioned, I work for the NFL as VP Football Operations, Youth and High School Strategy, and College Outreach, if that title isn't long enough. And I'm in the city probably 2 to 3 days a week. So leaving a little early, playing a little hooky today at about 3:30, 4 o'clock to try to get here on time to do this. I'm really excited and happy to be here. So I'm going to kind of just reintroduce kind of like my career accomplishments, my approach, and kind of get into some things just from a leadership perspective, how the NFL has dealt with COVID guidelines and that production of the game that you guys see on Thursdays, Fridays, Saturdays, Sundays. Sometimes, was it yesterday, the Ravens and the Steelers played in the middle of the afternoon. So all the changes that everyone's making to try to get the season going and still have a high quality of a game on television. So just some career highlights. I think one thing I'll say is, when you play 12 years in the NFL, when we had, real long training camps, that means I spent a year of my life in training camp. So that's about a month each year of camp. So a year of my life was spent in training camp. I love the experiences that I've had. I've lived in some great cities, and obviously where you get drafted is kind of where your heart is. So, I decided to move back. We decided, my family, move back to New Jersey area when football was over after completing my career with the San Diego Chargers back then. My wife's from the city. We have 2 boys. I'll get into that a little bit later, but Giants, Browns, Buccaneers, Chargers, and the key is to not be too upset when your career is over, because you don't want to end it by an injury or being cut, traded. And I think if you play long enough, all that's happened to you. But I'm very appreciative of the cities that I've lived in and the place I've had to play and the experiences that I've gotten. And many of you may not know that I was a part of the Eli Manning trade and which sent me from Tampa to San Diego in 2004, and that's why I went from the Buccaneers to the Chargers. So started a bunch of games, blocked for some great running backs, and had some great teammates like Michael Strahan and that at every level. And actually, one of the things I'm most proud of is getting my master's degree from Fairleigh Dickinson. You know, at the time, the NFL had a program it was really built for players that left early and didn't finish the degree. You could work with your local school, and this is again late '90s, so this is '98 to '01. There were no online courses. There was only, I think, DeVry and University of Phoenix back then, in the early days of online learning. And I physically went to class every semester for 15, 16 weeks. So it took me 4 years went part-time. I was in grad school my senior at Louisville when I graduated. And so those experiences took me through a lot of turns and a lot of internships. You know, we're obviously in Patterson today, and one of my greatest experiences was interning with Bill Pasquale in his office back in the days when I was finishing a paper for my master's degree. So I just definitely have a special heart for this area, this community, and the people really in Patterson. And obviously my current role. And if any of you social media buffs, I don't have TikTok, I don't do dances and any of those things, but I have Twitter and Instagram, and my name is the same on both accounts. So R_Oben on Twitter and Instagram. And so again, and one thing I wanted to mention with my family, and one of the things I really appreciate is my relationship with Dr. McInerney, who's the medical director of this hospital. And so I think in another life, I'd be an orthopedic surgeon, a medical salesman, or something, knees. And because when you play long enough, you've had literally every injury imaginable. So I have two boys that play football. I know over the last 10 years, there's been this discussion about playing football and would you let your kids play? And then that's been a big discussion. And so I'm a big youth sports advocate. I'm an anti-sports specialization person. I think you need to play different sports. And so my son, RJ, on the left, went to St. Peter's Prep. He's a redshirt freshman at Duke. They haven't won a lot of games this year, unfortunately, but again, he believes in what they do and their culture. He's a great student. I went to the University of Louisville, so he's smarter than I was coming out of high school. No offense to Louisville, I love my school. And then my younger son, Andre, is a junior offensive lineman, like me at St. Peter's Prep, and received his first scholarship offer at Temple back in March. So I'm officially the second biggest person in my household now. My younger being a 285-pound offensive lineman. And so, and have to always give a shout out to my wife, Linda. She worked many years in Hudson County as a prosecutor, working for the county prosecutor's office in Hudson County, and she now works at a boutique law firm in Newark, doing some special investigative things for Calcagni and Kineski. And so I'm going to start to talk about really the COVID updates from the NFL. A lot of you guys are kind of the new norm is empty stadiums and closer to shots and generated crowd noise and all those things that you guys have known to like this year or known to become accustomed to. But I'm just going to talk about historically how we got to this point. And when you talk about will the season be played, you know, that was a discussion that literally changed every single week from March 13th until the end of July. So a lot of folks were working a lot. I'm just kind of take you through it for 10 minutes or so, starting with the protocols at the team facilities and the practices. One thing that's important to convey is that the NFL and the NFL Players Association, NFLPA, really work together to develop these comprehensive protocols in what we call really the 7 key areas. So there's facilities protocols, educational protocols, team travel. You know, what happens when you leave the facilities, get on a plane, get to the hotel, get to the stadium, get back on the plane, and get back to the facilities, and making sure to ensure safety, screening and testing, treatment and response, game day protocol, and then obviously protocol for the media. The fans always want to make sure that they can get the same media interviews and the same quality of media interviews. And again, the top medical professionals, have to give a shout out to Dr. Alan Sills, who's our chief medical officer. He's out of Vanderbilt University Medical, and he's really assembled an excellent group of medical advisors, similar to guys at the hospital, to get this season going. Next slide. And so this was an interview that was done, just a picture and image slide. Sam White is on the left, and Reggie Johnson on the right. Sam White he works for NFL Network. You've probably seen him on television. The Rams, speaking of protocols, the Rams actually have the lowest case of COVID than any other team in the NFL, and just for the simple fact that Southern California weather, if any of you guys are familiar with that, it's anywhere from 68 to 72 degrees all year long, and so they're able to have outdoor eating, outdoor even locker rooms, outdoor everything, and so because of that, that gives you that natural air ventilation. So the next slide, I want to talk about how risk was mitigated. And so again, everyone was working together to mitigate risks. Obviously, the biggest change everyone saw back in July was no preseason. So how do you start a season with no preseason? And so players were allowed to train and obviously practice, but without any preseason games. And so, and the concern was the coaches wanted to make sure that the quality of play wasn't bad. And I don't think it has been. And maybe fans will disagree, but the quality of play hasn't been bad. If you look at that picture on the upper right, that's the Rams locker room. Similar to any classroom or anything that you've seen in restaurants, we've got individual lockers, socially distanced, using larger areas like basketball gyms, if you will, to have some of those areas become like de facto changing areas and not to be confined to the locker room where someone's right next to everyone. Again, the facilities overhaul, you've got infectious control officers. Every team has one, which is the ICO, and then the IDER is an infection disease emergency response, which is a plan that every team had to submit before. All 32 teams individually had to submit their plan, their IDER plan for how they were going to get through training camp and the season. So work together football operations with every single team to ensure safety and best practices. And this, just from a testing protocol standpoint, every NFL player is tested every day except game day. And it's a lower nasal swab. It's not the upper nasal brain scrape that everyone hates. It's a lower nasal. There's also antibody testing. And I think many of you may know that there are a lot of players. Nate Soldier, for example, Giants left tackle, you're talking about vacating $8 million salaries for $150,000 stipend because they didn't want to play. I think he battled cancer. I think lived with the grandparents. I mean, there are a lot of different issues that players had. He had wives that were high risk, and there were a lot of different things. So I'm sure many of you would sign up for a $150,000 stipend to stay at home and not work for a year. But obviously, I think the reason, you've seen players that no fault to them or no negative connotation about coming back next year because safety was the most important thing this year. So lower nasal swab, test every day except game day, and it's a 24-hour response test. So, and my son, RJ, who's at Duke, he gets tested every day as well. So you talk about your FBS programs have the same protocol, so everyday testing, if you will. Next slide. And then, innovation is also a part of it. If you start clockwise to the upper right with the Rams helmet, the NFL signed an agreement with Oakley. In the old days, really up until last year, you needed a medical necessity to wear a shield. And so everyone thinks a visor looks cool, but it gets hot and it's foggy. And so Oakley actually worked to develop a product, like an anti-fog product that was really breathable that players could wear. Because obviously, the respiratory nature of how how COVID is spread is obviously heightened in a huddle or on the line, or when you've seen these images of the players, breathing in a cold game, you can see the air coming out of there. So a lot of players are wearing these Oakley shields. I don't know if that's made available to the mass market, high schools. Affordability becomes a discussion, obviously. Bottom right, you see the electrostatic sprayers. Everything in the building, every single equipment, shoelace, everything is sprayed every single day. You see the Gatorade container. Every single person individually has their own bottle, and it's labeled with their jersey numbers. And then obviously the tracking. I wear tracking every time I'm in the city, in the office, so that if anyone actually comes down with COVID, it's who was close to the other person. So Yeah, I think that's it on that. All right, next slide. I think, you know, ongoing efforts for player education is important. I think there was when you talk about the medical community, and I think I'm speaking to people in the medical community on this call, whether you're a supporter, donor, or what have you, I think there's a general sentiment that just everyone shares in the responsibility equally, and in the risk. And I think given the politicization of the mask discussion and where that's gone in this country, and obviously we don't have to discuss that on this purpose, but I think it was really important that we educated players on where we are in this country with this pandemic, the severity of it. I mean, 250,000 people plus have died this year, and obviously players are risking their lives to play a game. And so where you see that sports was always the distraction from the real world, it's really now sports and athletes embracing things that are going on, and doing their part to ensure that they're being a better example, obviously to this, just the sensitivities of what's going on. So you'll see these are stickers and posters that are posted everywhere in every single facilities. You talk about wearing masks, practice distancing, every meal's grab and go. You know that, you know, and I think obviously you're missing the social component of that, and whether you're a college student, high school kid, and you're bored, and I think hopefully if this only lasts a year and we can get out of this, or a year, or whatever that's called, I think we can come out here better knowing that we all did our best to ensure safety for all parties involved. So I think it was a heavy dose of education. And so now I'm going to take you into just a little more granular about the protocols for game week and game day. Obviously, you guys see the TV product, but there's a lot of things behind the scenes that happen. So this diagram, for those of you, I have bad eyes, so I have to look a little bit closer. If you look at a stadium, minus the fans, that's a diagram, obviously, of last year, not this year. There's a lot of things that go on behind the scenes to just get a game planned, just to get a game operating. So network is really NFL network is what we call network personnel. So when you talk about personnel remaining 12 yards away from the bench areas at all times, pregame warmups, you didn't see a lot of the pregame shots this year. If you watched like those pregame shows on Sundays, you didn't see a lot of that this year. You see a really limited sideline. So there's really a max number of sideline personnel that can actually be at a game. So in the old days, you know, you would see like a Legends Day, or I don't know if you're Giants fans, you know, Lawrence Taylor and Harry Carson, you know, Legends Day come out, and all those types of events were eliminated. You know, my role, if you've ever been to a Giants or Jets preseason game where you see the kiddies at halftime play a game, you know, the Pop Warner kids, you know, those types of things unfortunately were eliminated. And even in the stadiums, states like Florida, Texas, where you do see fans, they still did eliminate a lot of those types of activities. So I think, you know, the good news is, and for safety, NFL rules superseded any state's jurisdiction. So the stands may look different at a Buccaneers game versus a Giants game, a Jets game at MetLife, but the protocols on the field were the same. And then I'll get into a little more specifics. If you could see this diagram, I know it's small fonts, but this is just an aerial diagram of the field. If any of you guys understand that, you know, the maps or the architecture of it all, like there's a sameness across the board. So the field access, when you talk about stadium operations, field crew, NFL network, films, all those things still exist. You know, there's rules about how close people are. And again, just based on the last slide, I'm kind of showing you more of a closer aerial view. And I think that the goal here was to just ensure the same quality of play. And then really, when you talk about essential, what's football essential to make sure a game gets played and there are no other issues on the field. So next slide. And so when you talk about the week of adaptation, so ops is short for operations. So when you talk about stadium operations, many of you have seen these interviews where the reporter is standing, 4 or 5 yards away, you know, with an extended microphone, or the coach is standing on a podium versus like the close-up interview. You've seen a lot of that. A lot of operational spaces and restrictions, walking paths, you know, just from an in-stadium standpoint. field operations, anyone that works in the stadium, it could be a parking attendant to anyone, has to get tested every week, a game week. So I think they get tested, I think Thursday, and they get a 24-hour test, so that by Friday, if someone comes up positive, even if they're wearing gloves or masks, anyone comes up positive, that person can be replaced. So that's security, stadium operations, all those people. Everyone in the stadium is tested. Second one, player access modifications. Again, in the old days, you'd have production meetings, interviews the day before. You've seen a lot of the Zoom interviews, the Zoom post games, practice access, all the sit down interviews. All those things were eliminated this year to ensure safeties. And I think some of the virtual engagement has created a lot of efficiencies, because you have to stick to the time of the Zoom call or the interview, and it's not wait until coach is ready or players ready to be interviewed. The next one is some of the entry protocols, and I'll just be brief on this and close it. Temperature screening, medical questionnaires. A lot of folks, depending on where you work, there's an app where you have to fill out, similar to your kids in school. You have to fill out a questionnaire every day. It's like a 14-point questionnaire. Do you have symptoms? Do you believe you may have symptoms? So you've got to answer literally no to everything every single day before you walk into a stadium or a practice facility. Again, the pregame meetings, all those things, the field access, armbands required. So again, a lot of things that are done to ensure safety and best practices. Next slide. And again, the next one is just player coach access, the booth, point of view cameras. You've probably seen the guys in the booth, let's say Monday night game, where they're actually literally sitting, further away from each other. Again, we're used to seeing the close-up shot where the guys are interviewing, and that's from a TV trick that engages the audience when we can look and talk to each other versus looking at the camera. Then that audience is engaged. But now we're all used to seeing everyone spaced out. And it's funny, I think when you come back next year, you're going to say, man, the stadium's loud, there are all these fans, and things get back to normal. It'll be kind of another adjustment. Again, and I just breeze through some of this. Go to the next slide. Oh, that's it. Oh, so that was the last slide. Yep. Sorry. Last one. Go back again. My bad. The other thing that you'll see the fan noise at the bottom, like curated audio. So stadiums are still allowed to generate crowd noise. Let's say for the away team, if it's the Jets going to Miami, for example, and they're on offense, they're allowed to generate crowd noise like up until a reasonable time when the ball is snapped, because you don't want to make an unfair advantage to the other team. So you'll see empty stadiums, but you'll still see the cheering and things, and then the music, and they want to work to create a game day environment. And so I know this is thank you. I know there's a Q&A portion here, and I just wanted to just thank you guys in advance and for just listening to me for a few minutes here on some of these protocols, and I'll be glad to answer any questions. I know I see Dr. Mack is on the Zoom, is on the webinar, so thank you for joining. And I'm just, again, I'm really appreciative, and I think I played a game for 12 years and started my life at age 34. In the real world, and I have a lot of respect for anyone that's, risking their life just to go to work every day to ensure the safety of others, whether you're a medical profession or business, education, anyone. And I think we're all in this together. And so I just want to say that before we go to the Q&A. So I think Rob, whoever's handling the Q&A, I'm ready for any questions, any and everything.
Great, thank you so much, Roman. That was great. Great to hear all these things that you turn on the TV and you don't necessarily think about, thanks to the fact that you guys and the teams have done such a great job, orchestrating everything behind the scenes, but really fascinating. We've folks have submitted questions to us, so I'm just going to go ahead and get right to it. One of the questions we've had here submitted to us was, how was it challenging for you to adapt, once to leaving football? How was that transition the day you hang up your cleats and then, start thinking about an office job?
Yeah. Well, I mean, the good news is I was an offensive lineman, and I think someone that showed me in his research that offensive linemen and quarterbacks actually do the best after football is over in terms of their career and their business interests and some of those things. So I mentioned the internship that I had with Bill Pasquale that was back in 99, 2000. And so I was an econ major at Louisville. I have a master's in public administration. I always kind of kept my foot in the parking lot, if you will, of what's going on in the real world and what problems I want to solve and how I want to serve when football's over. So, retiring in 2008 wasn't very easy because the whole country was losing their shirts, if you will, with the recession back then. And no one was going to feel sorry for a former NFL player who wants to dive into a new career. But I kept building good, solid relationships. I wanted to kind of solve problems corporately, I think the hardest part was proving to other people why I wanted to get into some other business, why I wasn't on vacation playing golf, and I think, or whatever that means, And I think everyone has this perception of what life is for an athlete. I think if you play 10, 12 years and you're still 32, 33 years old, you still have the rest of your working life to still do something. Your brain still has to work. So you see people buy and sell, start a company, sell it, and then go do something else, go do real estate. So I think playing the NFL is no different. And so if I didn't do things off the field, I wouldn't have focused on football as much. So I needed that balance for me, for my career. So thanks for asking that question.
Great, thank you. Another one here. What is the NFL doing to better develop the youth in underprivileged communities that a lot of players themselves come from?
Yeah, I started my foundation back in 2002, and I was born in Cameroon, West Africa, as it was read on the bio, and I obviously had a heart for kids back in Cameroon, needing computers, needing just basic necessities, and I know that growing up in DC, the DC public school system in the 80s, I think back then had a really low reading averages for public school kids. So I just focused on the things that are important to me. And this was in the 90s. But now I think every player does a lot off the field. And you look at the way the NFL is structured, it's every individual team is owned obviously by an owner, and the owners collectively make up the NFL, choose who the commissioner is, and they run our office. So every NFL team and every NFL club does a lot in their community. And I think sometimes there's this narrative that players don't care about what's going on outside of them, or if a player makes an opinion on what's going on in the world, they should stick to sports and not dive into other things. But I think we all have a platform, and you don't know as a player if that platform is going to last 2 years or 10 years or 12 years. But I think it's commendable, right? When football's over, and guys go back to Missouri or Jackson, Mississippi, or wherever guys are from, that they're still serving in their communities. And I've seen a lot of that. There's a lot of work. We're in Patterson. Victor Cruz does a lot in Patterson. Tim Thomas. I mean, guys that I know, my generation of guys that do a lot in the communities that they serve. So I definitely want to dispel any narrative that owners and teams and Giants and the Jackson players don't care about underprivileged kids, because there's a lot of work done in the communities. The negative is, in this area, if for every time I visited an elementary school in Patterson, I was saying no to Newark schools, Passaic. I was saying, so you have to just kind of figure out what problem you want to solve and what area you want to serve, and feel good about how you're growing in those areas.
Sure, great. Football question for you. So I guess they're asking about your, game, what happens after game day, and how, your work week is, so to speak, as an NFL player. I know you guys, you play on Sunday, then I think you're in on Monday, and then you're off on Tuesday. What's behind that type of schedule, and how is that?
Well, typically, in 2011, the practice rules changed. So you can only be in pads a certain amount of times throughout the year. I grew up in the pads, double sessions generation. Probably wasn't the best. Athletes got better, so you didn't have to beat them up as much, and you could be smarter about how you practice. Everyone stays on their feet. So game day Sunday, Monday you come and watch film, run, lift, do like a restorative lift. Tuesdays you're off, most likely. My older son was in, second grade when I got done playing. So I always look forward to okay, Tuesday mornings I get to take him to school and then pick him up so that was like my Tuesday. And so Wednesday and Thursday is your full days, because that's your heavy installation day, like offensive, defensive emphasis. Thursday would be kind of a 2-minute drills, special situations. Then Friday is kind of your walkthrough day before the game is travel if you're across the country traveling like Seattle to Miami, for example, and then game day Sunday. So it's this weekly cycle. Obviously, every team has to play a Thursday game. So if you play Sunday, then play Thursday, obviously it's a shorter week, but then you get that weekend off and you get 10 days before your next game. So I think that the league and the players union have all worked together to ensure that there's a sameness in schedule. There's an article I can forward to you. In the old days, Mike Ditka did it differently than what Don Shula did because of the heat in Florida, than what whoever did. Bill Walsh did it in the 49ers. And so over the years, we looked at if everyone can do it the same way, that prevents players saying, I don't want to play for that guy because that guy is a slave driver on the practice field, but this person believes in health and safety. The league has worked across the board to make sure that everyone really has the same schedule across the board.
Right. Another football question for you. This related to your success with Tampa Bay. In 2001, you were with the Browns, and they were 7-9. Then you go to Tampa, 12-4. You win the Super Bowl, and then the next year, I think the Tampa Bay didn't do so well the next year. How was it? First of all, we'd love to hear about your Super Bowl experience, but how was it? With those ups and downs as a player, how do you handle those?
It's tough because I think when I was a rookie, I got drafted in '96. That was the last year of Dan Reeves's tenure at the Giants, and then Jim Fossil came in after that, my second year, and so a couple of my buddies that were all playing the same Senior Bowl All-Star games. So my buddy that got drafted by the Packers, he wins a Super Bowl his rookie year. He was lucky enough to be. So it's not guaranteed. Nothing's guaranteed, and I think there's a saying from players that I'd rather be happy in Buffalo than miserable in Miami. But I did appreciate definitely going from really cold weather, Cleveland not winning, to going to Florida and then Tampa and playing for John Gruden, who was a great coach, and winning a Super Bowl. So it's really by chance, and I think God doesn't. I don't think God cares who wins the Super Bowl every year, but I'm just appreciative that I was able to get on a team where we had a lot of really good players on that team. And then the next year, injuries happened, right? Longer season, and then injuries happened, shorter off season, and then we didn't do so well the next year. And then the year after that, I get traded to the Chargers, and then we go 12-4 and go to the playoffs. And so it was really up and down every year. But I'm jealous of the guys that play for the Steelers because I don't think they've been under 8-8 ever, in 15 years. And so some of those, those marquee franchises, Patriots, they've won every year. They play at a high level. So none of it's guaranteed. It's just you just pray for the opportunity to be able to compete and win a Super Bowl with your team.
Sure. Right. We have a question about kind of related to youth, young athletes. Have you have any words of encouragement in these days during the pandemic for young athletes, trying to keep them motivated? They don't know if their season's going to happen, or it's cut short, or it's stopped, and this and that with practices. I know you have the experience with your sons, but any thoughts on that and comments?
Yeah, I just there's definitely a lot of the isolation that these kids are feeling when they don't have sports. I think the good news is I think kids are going to appreciate going back outside again and being a part of a team and playing, and all the things that our generation of parents saying, man, I used to go outside, and kids now are on their phones. So I think just stay encouraged. This is affecting a lot of people. My kids would have lost a year of just not being in a classroom and virtual Zoom classes and all those things. And so hopefully if everyone does what they're supposed to do, we'll be back to some sort of normalcy, or at least it'll start to trend back north on the normalcy scale as you get February into March, if you will. But I feel bad. I really empathize for the winter sports because they get killed on the back end last year, and then hit it on the front end of this year. So your wrestling, your basketballs. I'm glad the NBA was able to do it with the bubble, but indoor sports are really going to be a challenge because at least football you played outside, but indoor like wrestling, some of those things are definitely still going to be a challenge. And so between Governor Murphy, the state athletic associations, and even the rec leagues, they're all really dealing with it. So, and everyone doesn't have the same amenities. Everyone doesn't have, a kid still has to get in his car, go home, be with his grandmother, parents come back the next day, and obviously they don't get tested every day like NFL players. So I just say, keep your head up, stay encouraged. We're all going through this and we're all trying to really do our best to create some normalcy. I think everyone's used to working out in front of a screen or a monitor. I think that's something that's become the new normal. But outside of that, I definitely empathize with what kids are going through right now.
That's great. Well, listen, thank you very much, Roman. It's been great. We're coming up now on the close of our spotlight. We're very, very grateful to have you on. We'd love to have you back at some point again. As I mentioned at the top, it's great that Dr. Vince McInerney, is a mutual friend and was able to connect us, and we love to keep you as part of the St. Joe's family, Roman, and we appreciate you sharing all of your insights, your personal experience with us tonight. And I thank everybody who joined us this evening, and I wish everybody very happy holidays and safe holidays, and really a terrific new year. And we've got many things to look forward to next year. And let's hope that, as Kevin mentioned at the top of tonight's presentation, that looks like things, a lot of positive things, developments coming our way, and that 2021 we'll be able to put this pandemic behind us and start getting back to normal, so to speak. But again, thank you very much, Roman. Thank you to all our participants, and everybody have a good night. Take care. Bye-bye.
Good night. Bye-bye. Thanks, Roman. Vin McInerney. Thanks.
Thanks, Dr. Matt. Thanks, guys.